right? Especially, most especially at the antenatal section, the antenatal wings, right? These
Okay.
are meant to be made available. Are they always available? I'm
Okay.
sorry, but no. The reality is they are not always available. Well, there are different reasons why this could be the case, but it is what it is,
This is what it
right?
is.
They are not always available. The government doesn't have enough to actually procure them. We don't have enough sponsors actually sending them across for us to make them free, right? So when
Okay.
there is no source, no way to actually procure them from manufacturers, then there's no way for us to make them available for consumption. So
Okay,
yeah.
then. So now we've talked about that issue. So how do you think Nigeria now can address the issue of insecticide and because now, okay, how do you think the issues you have pointed out can be addressed? Yeah. So go on.
Okay, so how do I think these issues are pointed out can be addressed? Well, one, there is the moral obligation of every Nigerian, right, to make sure that their environment is clean. Let us even tackle the vector, the transmitting organism. Let's start from there, right? Okay, we agree it is expensive to procure mosquito treated nets. No disputing that. How about the one you don't need to spend money on? Simply clean your environment. Make sure that there's no trash in your drainage system so that you are not rearing mosquitoes.
Well, that's
How about
easy.
we start from there?
That's easy to say. If you don't have a toilet in your house, how will you keep your surrounding clean? Because then you have to open defecate, and
You
and
don't
it's a vicious
you
cycle.
you said sorry, I didn't get that.
Now I'm saying that you said keep your surrounding clean. Well, I'm saying that, for example, if you don't have a toilet inside your house and then you have to open defecate, how do you take care of? That's a vicious cycle, isn't it?
It is actually. Then now comes the issue of the chicken and the hen. Which one comes first? Which do we tackle first? Well, as far as I know, the government is at least in certain states, the government has made efforts, certain governments anyways, they made efforts to eradicate or to address this issue of open defecation. At least I know in Abuja there are places where there are public toilets set up. I mean, I'm not taking note of it in other states, but I know for sure I have seen several, new public toilets in
Abuja.
Abuja. Now,
Okay.
looking at, okay, that's talking about the issue of open defecation, but what about waste? The average Nigerian or the typical Nigerian, let me say, uses something, and for the waste, they just look for the nearest gutter and discard it there, or just drop it along the road. Sometimes you're driving on the highway and someone, a Nigerian, rolls down their windscreen, that's the window, and just throws
Throw it
their
away.
plastic container, the granite peelings and whatever it is, and just throws it down. You know, let's not even forget the accidents, the traffic accident that could lead to.
Lead to
But
that.
let's even talk about just the little things we can do to keep the environment clean.
All right. So,
Right?
without focusing on,
Related to these things. Yeah, sure, please.
yeah, the moral responsibility. Though we're not going to dwell on this next move by the immunization, because as we speak, the federal government has rolled out lots of malaria vaccines across the states, but that's not the focus. The focus right now is how exactly will the government achieve what's it called, the eradication by 2030. So now, what role do you think community engagement and participation play in Nigeria's malaria eradication efforts? Because you've pointed out the moral parts of it. How do you then get these people involved? Because now, like I said earlier, we've seen malaria as just headache. It's like, not be malaria. Now, if you see somebody even shivering, you say, not be common malaria. What is happening? You understand? So how do you what role do you think community engagement and participation and even awareness, sensitization have to play?
Okay. It's imperative. It's absolutely essential that we start from the communities. We can't keep, looking at just, addressing things at a somewhat superficial level. We need to go deep down to the grassroots, right? We need to go to the local areas, the rural areas, because that's where the problem actually mostly is, right? We have more prevalence in these areas,
Mm-hmm.
right? We need to engage more. We need to engage the communities more in advocacy. Through advocacy, we need to make treatments, preventive measures more available to these people, because it's only when these things are addressed from the communities, from the rural areas, right? That's when we can actually address the spread or reduce the spread, to the urban areas, right? So
Okay.
until we begin to do that, we can only do so much, and it could only be that we are just putting in effort in a somewhat fruitless venture. So yeah,
All right.
it,
So who's the we in this situation?
sorry,
Who's the we? When you say we.
yeah,
Okay, so I said who's the we? You said
of every level of the Nigerian socioeconomic stratosphere, like from the government to the citizens, the healthcare professionals, like everyone really. We have agencies that are taking these things up in terms of, focusing on malaria advocacy. We need to
mm-hmm.
take it down there.
Mm-hmm.
As healthcare professionals, we also have a role to play in making sure that these things are made, there is proper intervention at the local areas, right? We can't keep looking at focusing our expertise on only the urban areas, right? Healthcare professionals, we also need to reach out to these people, even the government as well, right? We need to also send in more resources, be it fund manpower, whatever it may be, to even the rural areas, right?
Mm.
All in all, we need to all, as a people, reach out to the local communities and make sure that there is continuous advocacy, there's continuous education, there is re-education.
Mm.
Or one of my mentors will say, um, um,
Yeah.
how do we put this
Okay.
again? There's
Okay.
a way he says it, right? That learning comes from transformation, rather comes from continuous learning, not just learning one time, right? We have to keep hammering on the dangers of malaria, the effect it has on their lives, the impact it has, the dangers of it. We need to keep letting people know, because at the end of the day, you could hear one thing once and it just blows by, but until we really drill it down into people, right? They may not really see the importance of it or why they should take it very seriously. So yeah.
Okay, so do you think this is a realistic goal by the federal government?
Do I think it's a realistic goal? It's a realistic goal if the needed work and effort is put in. Every goal, well, almost any goal is attainable, right? If the required amount of effort, the required amount of work, the required amount of resources are actually pulled in. As far as I know, the government is doing what they can, or as well as they can. Again, as far as I know, when it comes to allocation of resources, they are trying to pull in more, push in, pump in more resources, to making sure that we attain this goal. But our
True.
cooperation comes into play, our acceptance comes into play. Nigerians, we have this mentality of, since it's coming from the government, we won't take it seriously,
Mm.
right? But we need to also look at the fact that it's for our own good, not for the good of the government per se, right? So all of that comes into play. Is it attainable? I'll say yes, if all the factors are in place. So yeah.
Mm. Yeah, well, thank you so much so far, Nurse Martin. We're sharing insights. If you're listening to us, the federal government has reiterated its vow to eradicate malaria in the next 5 years. That's in 2030. The health minister came out a few days ago to give Nigeria the reassurance. And that's in line with, I think, the last administration had made some moves to stop the to stop malaria in the country by 2030. Put some things in place that by next year should have been activated to put us on track for to achieve that goal. So if you're listening and you want to share your thoughts on this, you can definitely call in. You can go to Facebook Super FM 927. That's our identity on all social media platforms. You can watch me live right now on YouTube, and so be a part of it, either on social media or call the studio line on 0805 092 That's 0805 092 or 0705 if you want to contribute to the conversation about the federal government saying it is set to eradicate malaria completely from the country, how obtainable or how realistic do you think the goal is? Do you see it working in the next 5 years? Okay, so now, Nurse Martin, I'm still going to ask you about waste because that's not entirely on. I want to hear what you have to say about the role of the government because if you check our waters, even the oceans, they are is black. You know, you go to other countries and you see blue ocean, green ocean, and you're mesmerized. But then it's not the situation because the waters, obviously, Nigerians openly defecate in it. We throw anything. Sometimes when you're at the beach, all sorts of waste will just the beach will bring every kind of dirty to you, like so it's become like a norm. And so you don't I don't know what the role of the community heads or traditional rulers or the local governments, the state governments, when it comes to waste management beyond just regular trashing of what did you call it, the granite pills and whatnot. So it's actually like looking at it on a larger scale. How do you keep these whole parts, clean? How do you keep every area clean?
Yeah. So I think this is where collaborations with other organizations and other agencies come into play. I mean, again, our government can only do so much, right? Even as a people, we can only do so much. Talking about, our waterways, for instance, as far as I know, there are
Yeah.
different organizations that currently exist, even within the country, that, take proactive measures when it comes to waste, right? Okay, not to mention any. There are some that there's one I worked with in 2020
Yeah.
that took up a project. They worked with, I think, one of the embassies, right? And they took up a project and they set up some waste disposal containers along, just around the city.
Mm-hmm.
There's another organization I know of that started up this trash to cash campaign, wherein you take your trash to them, recyclable trash that is, you take your trash to them and then they recycle these things, right? So organizations like this need to be encouraged, to work with the government, to
Mm-hmm.
work with the people,
Mm-hmm.
right? Such that more programs like these, more actions like this, can take place. Yeah.
Mm.
So that's that.
Okay, so how do you think the federal government can sustain its momentum and commitments to malaria eradication efforts over the long term? Do you think it can be sustained? Yeah.
Sorry?
Yeah,
Okay.
go on.
Okay. This will come down to addressing the issues, the prevailing issues on ground, right? As far as I know, that's fairly recent. I think on Monday, yes, on Monday there was the launch of the malaria vaccination program, in
Mm.
Nigeria. Apparently, it's meant to be in three phases. Phase one started on Monday in two states.
Mm.
Phase two is going to be happening in about 15 states, and then the remaining phases will be in phase three, which will be,
Mm.
next year, right? That's, an attempt of the government to eradicate this
Yeah, but we're not going to.
vaccination integrated into the routine.
Okay, so but the thing is, if you're listening, Martin, are you with me? Yeah, so without dwelling on the vaccination part, because there are a lot of reservations as regards vaccination. Not every Nigerian belongs to that school of thoughts that thinks vaccination, yes. So, but the thing is, now looking at other, fundamental approach beyond just putting money into this project, like, are there other ways that this can? We talked about waste management, right? So, sustaining momentum. What other ways can you take out of this?
Yeah, another way is to further improve our data collection, any send data, which are valuable in our efforts to the government, right? And then, of course, there need to be further sponsorship to make sure that, interventions actually get to where they are needed, especially the rural areas. I mean, there are communities that you can't get to without, having to cross through canoes and cross through rivers with canoes, and
And
you
wood
have to go
bridge.
through bushes and all that to
Yeah,
get to those
yeah.
areas, right? We need sponsorship in order to send both resources in terms of manpower, in terms of treatment plans, the anti-malarial kits, in terms of our mosquito treated nets, insecticide treated net, like we said, right? We need resources to actually take these things, to such areas. And of course, there is the need for, we've talked about advocacy, right? The need for further advocacy, again, advocacy, unless things are addressed from the grass, from the lowest level, we'll keep pouring in a lot of resources without fully achieving what we want.
Okay, well, spot on. So now how do we, okay, you said advocacy, but do you think that advocacy can actually make a lot of Nigerians see malaria as serious? Because in a case of when Nigerians hear pandemics, everybody is scared and you stay in your house. So the severity of the illness will determine how Nigerians will perceive how serious it is, will determine how compliant they will be. So do you think you strongly believe that advocacy will begin to make a lot of Nigerians see malaria as a serious issue?
You made mention of the COVID. What made us take COVID so seriously? Education. We simply had to educate the people. Oh, this is what COVID is. This is how COVID can be spread. This is why COVID. This is how COVID is. We were strong advocating.
Yeah, but the mainstream media. Okay, well, I think I buy into that in a way. The mainstream media should do a lot with when it comes to how malaria is perceived. But now, just for the sake of the fact that we're running out of time, there's something else the health minister said this week as well, talking about what's going on in the health sector now. He at the Nigerian Medical Association's 10th National Health Summit talked about healthcare delivery in Nigeria and how to translate policies to impact. Well, he lamented inadequate funding, and he's saying that this has negatively impacted the performance of the country's health sector, and that's why the goals cannot be met. He said the financing has not been sufficient for a very long time, not like it started today, with significant challenges in mobilizing funds and ensuring financial protection for much of the growing population. So now, this brings us to, because obviously the minister is the one making all these pronouncements, but then what are the consequences of inadequate funding in the country's healthcare system? I mean, you are in the practice, you're in the healthcare, the health sector. So what are some consequences of this?
Oh, the consequences. Okay. Where do I begin? Okay. The consequences can range from, economic downturns to loss of lives. We can also.
Okay. Why are you laughing? This is serious. No,
it's serious because it's serious. Yes. Sorry for my reaction.
No, it's fine. It's fine. I mean, it's a free world.
The repercussions for this it's overwhelmingly alarming. It's severe because when resources are not available, as care providers, we cannot render the necessary care, right? When we cannot render the necessary care, we have people whose conditions continue to deteriorate. Complications begin to arise. Take as somewhat common, well, it is common as malaria is with the incident rates, right? If not properly handled, it can lead to loss of consciousness, it can lead to coma, it can lead to even death. We've had death cases, right? There was a time they said every 2 minutes a child dies from malaria. I think that was a publication in 2014, if I'm not mistaken. Mm-hmm. Right? Every two, you can, as prevalent as malaria is, without proper intervention, without early intervention, right? And this was still the time when interventions, so what do you call it now? Things like chloroquine and what have you were still, in use, right? Banned, then right? They were relatively easily accessible, right? But then we were still having these things, right? So, if fundings are not made, if proper funding is not available, the truth is there's nothing we can do, and it's going to affect literally all sectors of our living, all domains of life. It's going to affect our economy because we won't have people who are healthy enough to put in the work needed to generate revenue, right? It's going to impact even our things like our education. When you don't have a healthy teacher, who's going to teach your kid?
Yeah, makes
right? It's
sense.
going
Yeah.
to impact our transportation when the driver is not healthy. I mean, you go nowhere,
Yeah. So I don't mean to
right?
take us back, but something cross. So now, with the issue of, because you talked about over the counter, do you think that encourages this? Because that could be that, just looking for ways to make fast money. Even when it comes to buying malaria drugs, should it be based on prescription? Do you think what body or commission or agency is to oversee that, to ensure that pharmacies and chemists and those wheelbarrow shop, because everybody sells drugs. I see some wheelbarrow guys pushing and selling drugs on it. But now, so how can this be regulated? Because malaria medicines are easily accessible, and that might just encourage why self-medicating and all, it's not taken seriously.
I think this is where government policies come into play. There, I said, I know of a lot of countries where you can't get over-the-counter medications you can't get any medication whatsoever without a prescription. Now, in healthcare, we have our medications are classified into different categories. We have the over-the-counter medications, we have the prescription-only medications, we have the medications like your paracetamol, for instance. Now, there are certain dosages that must come with a prescription.
Okay.
Right, you can't just go, like, if you're getting like a pack, is it a pack, don't remember the quantity right now, but there are certain quantities that you require prescriptions for, right? Yeah, it all comes down to the implementation of government policies. Well, and then again, coming down to the moral value, because the government can have policies in place, but you and I know, as humans, will always find ways, and as ingenious Nigerians, brilliantly intelligent Nigerians that we are, our people, our brothers and sisters, we keep coming up with innovative ways of trying to manipulate the policies we have. So it comes down to the implementation of set policies and guidelines. When it comes to the roadside vendors that sell a bunch of these prescriptions, for instance,
You
these
don't even need
drugs, for
prescription.
instance,
Yeah.
you know, for that, well, it cannot be helped. I guess that's where our law enforcement agencies will have to come in, because I mean, you don't expect as while our policymakers in the healthcare are making the policies, and even us as providers, we are trying to implement these policies. We can't be on the streets trying to grab or hold or catch or all
Yeah.
these roadside vendors
Chase
who
those
have
wheelbarrow
nothing,
guys.
absolutely nothing to do with healthcare.
Yeah.
So,
Okay, so now, how do you think the funding in the health sector can be increased?
okay, this can be increased in quite a number of ways, actually. One of which is the compensation for, or the encouragement of more production in the country. I think that will affect the cost of procuring the medications. Drugs right now, my advice to a lot of people, anyone I come across right now, is don't fall sick, because the cost of
How will
treatment
you
right
help
now.
the person? How
Yes,
would you fall sick with
yes,
mosquitoes
don't, like,
everywhere?
no, don't, for in the sense, take good care to take good and proper care of your health, right? Because the
Yeah,
cost of
yes.
treatment right now is truly on, like somebody said,
It's off the roof.
you doctors use bills to kill, or medical professionals, let me not say doctors, medical professionals use bills to kill their patients after treating them, right? I mean, it's a sad reality, but it's what we have available to us that we'll use,
Mm,
right? Resources need to be pumped into the production of these drugs. We need to figure out, encourage, the formulation of more affordable, solutions, right? We need to also encourage even the care providers,
yeah.
right? In terms of, we've been talking about addressing this issue of brain drain for quite some time in the country now. We don't have enough providers. So even coming down to sending manpower to rural areas, places where these people are needed, we may not have so much. In Nigeria currently, I don't think we have a problem of manpower. Okay, we simply have a problem of, proper compensation of, the available manpower, right?
Manpower.
There is also the issue of encouraging a more holistic approach, natural ways of addressing these things. The government needs to also support
Mm,
when it comes to the natural holistic care, integrative care practices, right? I
okay.
know I know Lagos state government is doing that already. They're already encouraging having structured trainings for naturopath, such that people get to know that even as little as the food you eat, the kind of foods you eat, the plants you have around your house, they could also help you. You don't necessarily need to spend so much on,
Mm.
even the medication. So government
Lagos
really needs
is,
to look into that and invest a bit more on that as
yeah,
well.
and
Yeah.
Lagos is big on street food. One state where you just find food in every corners, and that contributes to the waste issue as well. What I'm saying is, when you finish cooking and you just throw the water, and so, but then, uh,
Drainage. Let's say the drainage in front of my house, it leads to wherever it's meant to lead to, and the drainage is as it should be.
mm-hmm,
If I am throwing wastewater into the drainage that doesn't have whatever like solid things that will clog it anyways, right? If I'm throwing the wastewater into the drainage, it shouldn't be a problem.
it shouldn't be a problem, right?
Yeah.
Okay, so now how do you?
Not going to gather up somewhere that's gonna again rear mosquitoes.
Hmm. So now, when it comes to funding in the health sector, this is not entirely up to the federal government, right? Because now, upon implementation of the local government autonomy, what are your expectations of the local governments when it comes to the primary health care across the country?
My expectation. You mean my expectations, right?
Yeah, what do you expect the local governments to do with what's the situation with primary health care, and what changes would you like to see in the primary health care across the country?
Yeah. Okay. So I would like to see in the primary healthcare settings, I would like to see more competent hands there, right? I've had the opportunity of visiting a few during my service, the local government where I served, during my youth service, the local government where I served, right? That local government, the primary healthcare facility there was manned by no more than 3 persons.
Wow.
In fact, I don't think I ever saw more than 3 persons in the facility, like throughout my time there. Right, so we really need more hands in this, more competent hands in this place. We need these places to be equipped with the necessary resources, and tools that are needed to actually function in this place. Right, there is another local government. During my internship, I had a chance. I was posted somewhere, and there we
What
had an
happened?
emergency, and it was something that under normal situations should have been handled in a primary healthcare center, but because we didn't have what was needed, we had to refer. Thankfully the person survived, but I mean, not everybody is that lucky. Right, we need equipment in the
The
local
primary
government
healthcare, yeah.
primary healthcare facilities. Right, we need manpower, we need good places. Even the environment that these primary healthcare centers are located, sometimes they are surrounded by bushes.
I,
So at the end of the day, you're treating it, becomes a situation of buy one get one free, or treat one get one free. Right, you're trying to remedy one
yeah.
situation, you're taking
And
another
then
one
you're
home.
saving another one. No, it's these are actually serious issues, and usually I feel guilty when I laugh about it. I heard about a primary healthcare in a village down south that actually performs surgery on their patients. So to add to what you're saying, maybe the local government can also like come up with ways to tighten the activities of the punishment for some of these activities, because I don't know, you're in the practice. Are local government primary healthcare supposed to carry out surgeries on patients? Do they have
by
that?
by virtue of the definition of primary healthcare centers, no. The primary healthcare centers are meant to be first lines of defense in case of emergencies, right? When it becomes, talking about invasive procedures, well, in that kind of situation, the person is meant to be referred, to a
General
secondary care
hospital.
facility,
Yeah.
right?
Okay,
So
well.
like your general hospitals, for instance, right? In a situation whereby for a routine procedure, the reason why we have theaters in places like in the primary health centers are simply for emergency situations.
Okay, not for actual
Someone,
surgery.
sorry,
I said not for actual
no,
surgery
not
and
for not for routine procedures, no. Take for instance, someone comes to the hospital with is a case like um, appendicitis, for instance, right? It's not ruptured yet. The person can still make the trip to a secondary healthcare facility. If it's a situation of ruptured appendix, for instance, well, yes, in that case, we can now, begin to permit,
okay.
primary healthcare centers to perform such procedures.
Okay.
In a situation
All right.
whereby a pregnant mother is in labor,
Mm-hmm.
right? She can go to the primary healthcare center for delivery. That's not a problem. It's an emergency. Taking too
Okay.
long,
And
you
you
could
have to
lose,
do
you
that.
could put the life of the child and mother at risk.
Okay. Now, how do you think the Tinubu-led administration can address the brain drain situation? Because a lot of people are now wanting to come to study your course, that's nursing, so that they can jackpot from the country. But how do you think now that, because this cuts across all medical practitioners, how do you think this should be handled by this administration?
Um, okay. So the one way, of course, the primary reason for the jackpot syndrome when it comes to healthcare professionals is the compensation plan. A vast majority of healthcare professionals have the same testimony. They would rather prefer, left to them or left to us, would rather prefer working in Nigeria than working in a lot of these countries, because in most other countries, you are at risk for everything and anything.
Okay.
Okay, as compared to Nigeria, whereby you are allowed to actually fully practice, right? Like really practice in terms of practice. So if the government can put in a little more funds in terms of the compensation of healthcare providers, then yeah, that's going to go a long way in addressing the brain drain situation. Again, brain drain is not, as far as I'm concerned, brain drain is not the actual, like when it's or let me say brain drain via or caused by the relocation of care providers from Nigeria to other countries is not really the primary problem, or that's not what's affecting Nigeria, because even in this same Nigeria, despite the mass exodus of care providers, we still have lots and lots of unemployed care
Doctors.
providers.
Wow, that's serious.
As a nurse myself, I know several nurses. I manage an association for nurses, right? Nurses nurses are trained in diaspora. And one of the requirements for us to get our license to practice in Nigeria is to do our internship, which is meant to be for 1 month. This is after passing the nursing council exams and getting inducted, right? We have to do an internship for 1 month. But then I know of several nurses who spend over up to 2 years without getting a placement for internship. I don't tell me now that we don't have need for these people. Of course we do.
So while there's
Right?
brain drain,
But we don't have the resources, or the story is we don't have the facilities, don't have the needed resources to actually pay for these persons.
So we have to
So
wrap it
government
up
needs to make
now.
provisions for these things.
Yeah. So while there's brain drain, there is underemployment. Okay, now let's wrap it up with the big question. The reason for this conversation now. Do you honestly believe and think that Nigeria can and will eradicate malaria by 2030?
Do I believe that Nigeria will eradicate Nigeria? Will eradicate Nigeria? Yes.
No, I didn't say eradicate Nigeria. Where do you want all of us to go?
Sorry, eradicate malaria.
Malaria,
Sorry.
yes.
Eradicate malaria. Sorry about that. Do I think Nigeria can eradicate malaria? Yes. Do I think Nigeria can eradicate malaria by 2030? That's
What happened?
there's work that needs to be done to
What
make that
work?
happen.
Can we not
There's
perform
there's a
magic?
possibility of it
No, but
happening,
yeah.
right? But the probability is, I'm sorry, not in our favor as at the moment.
All right. So, as much as I would like to stay on the conversation, I have to go right now. Thank you so much, Nurse Eyube Martin, for joining on the program. Thank you so much. Enjoy the rest of your day today.
Thank you, and you too.
All right, then. So that's it on Spotlight. We reacted to the minister's comments during the week, as recent as yesterday, on how we can kick malaria out of our country. We're hopeful. Keep our fingers crossed. 2030 is just 5 years away. So let's see how it pans out. We won't draw any conclusions yet. At least the minister has asserted that moves are made to kick out mosquitoes from the country. So we'll see how it pans out. All right, then. Thank you so much for being a part of Spotlight this morning. We'll do this again tomorrow. That's the final edition for the week. Enjoy the rest of your week. Stay tuned to Super FM. I'm Kimberly Ubiabo. Don't go away.